What is the difference between an abnormal pap smear and cervical cancer? Imagine a routine check that can catch potential health issues early before they become serious. That's what a pap smear does. When you get a pap smear, cells are gently scraped from your cervix and examined under a microscope. If the results show that some cells look different from normal, that's called an abnormal pap smear. But it's important to understand that an abnormal result doesn't mean you have cancer. It simply means that some cells aren't looking quite right and need further investigation. These changes can be caused by infections like human papillomavirus or HPV, which is very common, or by irritation, inflammation, or other benign conditions. Sometimes, the cells show mild abnormalities, which are called low-grade lesions, and often they go away on their own without treatment. Other times, the abnormalities are more serious, called high-grade lesions, which could develop into cancer if left unchecked. Now, cervical cancer is a different story. It's a diagnosis that means cancerous cells have actually formed in the cervix. This is a malignant disease that can invade nearby tissues and spread if not treated early. Usually, cervical cancer develops slowly over many years, starting from high-grade precancerous changes that are detected through screening. Confirming cervical cancer requires a biopsy, where a small tissue sample is taken from the cervix and examined for invasive cancer cells. Treatment for cervical cancer depends on how advanced it is, and options include surgery, radiation, or chemotherapy. The key difference is that an abnormal pap smear is a warning sign or a screening result indicating that some cells are abnormal but not necessarily cancer. It's an early alert that prompts your healthcare provider to do more tests, like HPV testing or a colposcopy, to see if there are precancerous changes or if further action is needed. Many abnormal results, especially low-grade ones, resolve on their own or can be managed with minor procedures. Cervical cancer, on the other hand, is a confirmed diagnosis of invasive disease that requires specific treatment. Screening with pap smears and HPV testing has made a huge difference in catching problems early. It helps prevent the development of invasive cancer by identifying abnormal cells before they turn into cancer. That's why regular screening is so important, especially for women over 21 or those with risk factors. If your pap smear results come back abnormal, your doctor will guide you through the next steps, which might include additional tests or close monitoring. Remember, an abnormal pap smear is not a diagnosis of cancer but a sign that further evaluation is needed. Always consult your healthcare provider for personalized advice and follow-up care.